A recent international study from the University of Missouri School of Medicine and researchers in Israel found that sleep-deprived doctors show less empathy for patient distress and that this impression affects their prescribing behaviors. The findings of the research were published in the journal Proceedings of the National Academy of Sciences.
You wake up and you bang your face against the almirah and it knocks your two favorite front teeth out. So you go to a dentist and you know what? If the dentist prescribes you paracetamol for your two front teeth, you are going to have serious trust issues all your life. It's not that your dentist was incompetent, he was not unqualified. There might be just a different reason altogether. In fact, a recent research in Israel has shown that doctors who are sleep deprived are less likely to perceive your pain, and this affects their perception of how much pain you are in, and this also affects their prescribing behaviors.
The study tested 31 resident physicians in Israel who were just starting their day and 36 just wrapping up a 26-hour shift. They read through a clinical scenario describing a female patient with a headache and another scenario describing a male patient with a backache. The physicians then answered questions about the magnitude of patients' pain and reported their likelihood to prescribe pain medications. The doctors wrapping up their shifts registered significantly less empathy for the patients than those just starting. Pain management is a major challenge, and a doctor's perception of a patient's subjective pain is susceptible to bias, said co-author David Kozel, MD at the Mary M. and Harry L. Smith Endowed Chair of Child Health in the MU School of Medicine. This study demonstrated that night shift work is an important and previously unrecognized source of bias in pain management, likely stemming from impaired perception of pain.
To make sure that the findings were verifiable and tenable, the researchers went through more than 13,000 medical records of patients who were coming into hospitals in the United States and Israel. It was found, according to the research, that the tendency of night shift physicians to prescribe painkillers was much lower than those working in the day shift. This meant that doctors who were sleep deprived or who did not get sufficient rest did not perceive your pain, no matter how severe, as much as they might have been required to do.
To verify their findings, the researchers analyzed more than 13,000 electronic medical records, discharge notes involving patients arriving with pain complaints at hospitals in Israel and the US. The study found the physicians' propensity to prescribe analgesics to patients presenting with severe pain during the night shift was 11% lower in Israel and 9% lower in the US. According to the researchers, the results highlight the need to address this bias by developing and implementing more structured pain management guidelines and by educating physicians about this bias.
Now you know and have an idea about how the quality of your doctor's sleep might also in some ways affect your treatment. Of course, however, for now we don't really advise you to get in touch with your doctor and ask him about how he slept before you go for your consultations. Al Mali, Hornbill TV.
For more news and updates, stay tuned to Hornbill TV. Goodbye.